They put themselves last and self-care comes
Yes,
last.
stress, right. And so I try to give people encouragement that I'm glad you're here sitting in front of me because this is important. It's easier to hold on to what you have though to get back what's left.
If a picture from a year ago, you have better hair than you have now, and it has not improved in a year, go see someone.
Right. Did you want to know what's going on?
Yes. When should a guy or a male, female, when should they actually, at what point in their hair wellness journey or hair loss journey, should they consult a professional?
I think that's a big question for women, not knowing if they should go in, if there's something wrong, are they imagining it? A lot of women, patients also feel like it's frivolous and they're just being vain and they're really down-putting.
They put themselves last and self-care comes last.
Stress, right. And so I try to give people encouragement that I'm glad you're here sitting in front of me because this is important. It's easier to hold on to what you have though to get back what's left. And so I think signs where you're seeing more hair than normal is coming out in the shower, hair on the pillow, more hair of a brush. Your ponytail feels smaller than it has in the past. You are quite literally seeing shedding and hair coming out. These are signs of maybe a telogen effluvium, which is a shock loss, the more active phase of androgenetic loss or even inflammatory condition loss should be treated a little bit differently than everything else.
I'm a huge prevention and preemptive person. You know me, I'm in holistic and yoga and Ayurveda. For me, it's very, very simple. If you start to keep your hair down a lot, or if you just start to feel like you don't feel comfortable with pulling your hair back, or if you're opting for more and more, like these are all telltale signs. A very simple cue is if a picture from a year ago, you have better hair than you have now, and it has not improved in a year, go see someone.
Right. Did you want to know what's going on?
Yes.
And that's the most important because some of the treatments that we
See online are not appropriate for any type of hair loss.
And a huge part of treating hair loss in the very first 10 to 15 minutes is just destigmatizing it and also making sure they know they've done the right thing. Like we put ourselves last. And more than that, we just feel like it's something we did to cause it. And I always tell my clients, you didn't do anything. You're doing something for life. So chances are you had a bunch of stressful episodes. You probably had a couple of kids. You probably you had a breakup or two, maybe a few house moves, even planning a wedding.
Yeah.
Every time you tried to lose weight, you probably had some nutritional deficiencies. You lost hair, you had some stress. So I tell every person that I'm consulting, hair loss is a whole story about you having lived your life, your diet, your breakups. I mean, somebody who is taking Harvard exam week, that's a lot of stress. It's going to have a little bit of impact on your nutrition, on your hair, all of that. So I'm like, hair loss happens because life is happening.
Is in your hormonal status.
Yes,
Big one.
hormones are hugely changing. So I often find that there is a huge weight that lifts off someone's shoulder when you tell them, you didn't do anything wrong. It's your life happening. And we are not hermits. We cannot stop living life.
Right. Then there are options.
Yes.
There's a range of options. And for some patients, honestly, they may want to do botanicals. And then the laser cap, and if we don't reach exactly, like say there's still one stubborn spot, we can do surgery there. There's a range of things. So it's not that you are ever stuck. There are a lot of options, and just having somebody who is open to talking about all the options, I think is important. Never say she deserves